Bonjour, bonjour, mes amis, and welcome to this evening's webinar. And I will start by saying Happy St. Patrick's Day because the day has inspired this evening's content. So, if you're familiar with the legend, and I'm not going to lie, I had to Dr. Google it before this. According to the legend, this day is in commemoration of St. Patrick, who drove out the droves and droves of Ireland, drove out Ireland, drove out snakes from Ireland. So, in honor of that, in honor of Nepeta again being a show crasher, we are talking about things that you might want to be considering driving out of your body, snakes that you need to be rid of in order to achieve health. And to do that, we have our crowd favorite, our fan favorite, Dr. Richard Horowitz with us, who is a best-selling author and Lyme expert. And he is here to talk all things little itty-bitty snakes that crawl into your body and unfortunately create conditions that are set for disease. And until St. Patrick drives them out, they are something that is going to be wreaking havoc within the body. Dr. Horowitz, hello, sir. How are you doing this evening?
I'm doing great. Thank you for inviting me again, Krista. Good to see you.
Yeah, it's wonderful to have you back. Um, so, as you know, our audience often fills out a quiz so that we know who they are. And I'm going to give the audience a few more moments to do that. And as we do that, I wonder if you can talk to me a little bit about spirochetes, because as much as there might be metaphor behind this evening's webinar, spirochetes are kind of crazy little funky things that are a little bit like snakes. Do you want to talk
Yes,
to our audience about those? Yeah.
sure. So, the spirochetes that everyone has. So spirochetes, it's like it sounds, it's spiral-shaped bacteria, right? So a lot of people have, in fact, most I would know would have denticola spirochetes. These are spirochetes in the mouth that just about everybody has. Unfortunately, when you have, for example, other bacteria in your mouth like Porphyromonas gingivalis, which causes gingivitis,
Mhm.
and you mix that with these denticola spirochetes, some of them from the inflammation in your gums gets up into your brain, and it's been responsible for some cases of Alzheimer's disease.
Yeah.
So these denticola spirochetes with Porphyromonas is, one of the causes actually of our dementia epidemic, as is Lyme disease. So Lyme disease is a spirochetal infection. And there's not that many coiled shaped bacteria. Helicobacter pylori is another one, that comes to mind. They've actually even found that in the brains of certain people with dementia. So these spirochetal infections, they're dangerous. I mean, denticola spirochetes, everyone has. It's a normal part of your flora. But you don't want to have gum inflammation associated with it. And certainly with H. pylori, people can go on. It can be an early form of gastric cancer in some cases, apart from ulcers and gastritis. And in the case of Lyme disease, of course, I mean, this is Borrelia burgdorferi is one of the worst spirochetal infections you could get, like syphilis, right, years ago, another spirochetal infection
Mhm.
associated again with dementia. So we're dealing with bacteria at this point that are kind of coil shaped, right? So yes, it's completely appropriate. And on the day of St. Patrick's to say we're gonna drive out the spirochetes. We're gonna talk about
Yeah.
today how to get them out of your body. And based on some of the research I've been doing for the last 41 years, I do believe it's possible.
Yeah.
Before you and I came on, I was discussing a Canadian patient in a consult I was doing today with one of his naturopaths, and
Yeah.
the naturopath had experience using Dapsone combination therapy for treating Lyme, which we'll discuss today. But
Yeah.
fortunately, there are options now that we have, and we'll discuss classical treatments, integrative treatments. But you do want to drive out
Yeah.
these particular spirochetes out of the body. They're not healthy for you.
Yeah.
So yes, very appropriate on St. Patrick's Day.
Yeah. And I like that you're bringing in effectively little nuances that each bug is going to bring into the body. Like I recall with COVID, what was really popularized there was spike proteins. There's this unique element to the infection that needs to be addressed before we even consider the other ramifications of the infection. So it's this awareness of the infector matters, the snake matters, as well as the impact of the snake. So it's kind of a two-pronged approach.
Right.
Yeah.
I mean, you know this from your training, and I'm not sure most of my internal medicine fellows do, but the terrain of the body is as important as what gets in from the point of view of infection, because many people get infections, but they don't get severely ill. And then you can have a terrain where you have lots of inflammation, which we're going to talk about today, coming
Mm.
from leaky gut, inflammatory bowel. I mean, there's a lot of places where it can come from. And depending on your terrain and how much inflammation is there, when these infections get in, whether it's bacteria, parasites, viruses,
Yeah.
different fungal infections, they will have an effect on your body based on how your terrain is able to handle it, based on your
Yeah.
genetics, based on your detoxification pathways, right? All of these things play a role. And we'll discuss today the 16-point MSIDS model that I developed for Lyme, which is applying to actually a lot of different diseases. So people can kind of have an outline that when they have inflammation, they have a logical place of where to start.
I love that. I love hearing that because inflammation is such a recurring topic that we approach. And it's something that's also this very difficult thing to say, here's how you start with addressing your inflammation. Before we dive into that, Dr. Horowitz, I'm going to ask that either Vanny or Maya bring up the quiz because I want to know who is showing up for us in the audience and how Dr. Horowitz and I can best speak to you today. So, the first question that we asked is, what symptoms best describe your current experience? And this, again, a little bit of an assumption that you're experiencing symptoms today, probably why you found your way into this webinar. And a majority of our audience, Dr. Horowitz, is experiencing a combination of fatigue and brain fog, that being the predominant thing, which you and I would hear both often in our practices. And then tied for second, we're looking at pain that migrates amongst joints. And I know you have a lot to say about that. And then tied with that is digestive distress. Okay, so wide variety of symptoms. And I'm grateful that through your model, through the 16-point model, we'll talk to the end of how some of these can be tied together and unified. Yeah.
Great.
The
Um,
next, please.
So just regarding the migratory point, for those of you who actually filled out pain migrating, that is the hallmark of Lyme disease, right?
Mhm.
There's only 7 diseases in medicine. You should just know this. This is really important that cause pain to move around your body. And the other 6, which are not Lyme, I usually joke with doctors, unless you were at the bottom of your medical school class, you'll usually be able to tell the difference between hepatitis, ulcerative colitis and Crohn's inflammatory bowel, acute rheumatic fever, Reiter syndrome, gonococcal arthritis, and lupus. Those are your other 6 diseases,
Got
which
it.
truthfully don't really resemble Lyme disease at all.
Yeah.
The problem with fatigue and brain fog is that is Lyme, that is chronic Bartonella, that is long COVID, that is mold toxin illness. That can be heavy metals and other environmental toxins. It can be due to, intestinal hyperpermeability. So that there's a lot of kind of things that drive that. Although in our practice, when we see chronically ill patients, and I've seen over 13,000 in the last 41
Mhm.
years of practice, a lot of times Lyme, Babesia, Bartonella, mold. In fact, all of these things play a role, right?
Yeah.
But again, as we talked about, it's really the terrain that's telling you how much that inflammation is going to affect you, and even instability in mood and sleep, very very common with
Yeah.
Lyme, Bartonella, mold. They all overlap. Same thing with long COVID.
Yeah. Yeah. So, as horrible as the experience of migratory joint pain is, there's an element of it being a gift because it really directs how you go about evaluating someone and then treating them. That kind of shortcuts you a little bit.
Correct.
Okay. Okay. I like that. The next question we asked our audience was, how long have you been looking for a solution to your symptoms? And it saddens me that a majority of people sit and have filled out 4 to 10 years. So
Right.
they have been sitting with their experiences for quite a while. Another, almost a third of our audience as well is saying more than 10 years.
Mhm.
They are saying that I've been really struggling with this. And I already see your look of empathy in
This
that,
is my experience.
unfortunately. Yeah. Yeah.
Right. I mean, this is unfortunately most people who come to see me have seen 10, 20, 30 doctors. The all-time high was 100.
Oh, mon Dieu.
By the way, in the Canadian patient I spoke to earlier today in the
Yeah.
consult model,
Yeah.
he was down to Mayo Clinic. Mayo Clinic, he's been to multiple neurologists in Canada for the brain fog and for the
Yeah.
symptoms. It was only, by the way, the naturopathic doctor I spoke to today.
Hmm.
He had a handle on it, but the other doctors, he had seen
Yeah.
multiple physicians, said he had actually suffered for 3 or 4 years.
Yeah.
And today I was able to confirm based on photos he sent me and the rest that,
Hmm.
what it was about.
Yeah. 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 And we'll get there. Audience, part of today is so that you can improve your awareness, your education, so that you are empowered to talk to your provider, talk to your physician, so that you can start down this pathway. That's part of the empowerment and the wisdom we're hoping to share with you today. The next question we asked our audience is, What is the most vulnerable part of your internal terrain? We have an educated audience here, people who have followed Dr. Horowitz, follow DNA Co. So I love that you already know what we're talking about here. A majority of the audience is talking around gut sensitivity. So either sensitivities or bloating. So we'll explore that in particular, how different snakes, quote unquote, can influence that. Another part of our audience is saying detox capacity, namely that they have a lot of brain fog and chemical sensitivity, which goes hand in hand with these diagnoses before and afterwards. Yeah. The next question we asked is, have you been informed that your test results are normal, but still feel unwell? And this is unfortunately so common where someone's good on paper and then they're like, but I don't feel good. And 44% of our audience is saying on paper they're A-okay, but they do not feel well. And 22% of our audience, those I would imagine have a little bit more of a cyclical or a inconsistent pattern of disease, say occasionally. So occasionally they're okay on blood work, occasionally they're not. Yeah. And we'll speak to some of the whys behind that. Last but not least, what would provide you with greatest clarity moving forward? Majority of the audience said all of the above. So, Dr. Horowitz, we're looking at what to be aware of testing and when. We're looking at more of a personalized and methodical action strategy, which I'm grateful, you've already alluded to in terms of inflammation. We can offer that to people. And then last but not least, I would argue, this might be most important, understanding how terrain affects recovery. Because terrain is part of that recovery, right? You're gonna descend back into disease conditions if you're not addressing the terrain as well.
Absolutely.
Yeah, yeah. All right. So, audience, without further ado, we are going to dive in. I encourage, if you have a question, please do toss it into the Q&A box. We will address those a little bit later on at the end of the presentation. And if they are not addressed at the end of the presentation, this will be something the remaining stragglers, the leftover questions, will get addressed via our Facebook page. So we encourage you to join there if your question is not addressed today. All right, Dr. Horowitz. Let's start with this idea of terrain and how it disrupted how the terrain influences what can disrupt the terrain and how the disruptions to the terrain will dysregulate the terrain. I don't know where to start. I gave you a little bit of a chicken and egg there, but why don't you start talking about the body terrain and how that very much influences, do you receive a snake, and how, if so, how?
So let me first give people a sense of the model that I'm going to be sharing with
Mm,
you today. So this 16-point MSIDS model, MSIDS stands for multiple systemic infectious disease syndrome. There's no part of the model that I personally discovered, but what I kind of did is put it together in a gestalt that just made it easier for doctors and patients to say, okay, I'm sick with a chronic fatiguing, musculoskeletal, generally neuropsychiatric. A lot of people have the mood disorders and the brain fog. Some have cardiopulmonary symptoms. Many, as you saw today, have insomnia with it. Where do I start? And generally, what this model says is it's almost if you went into a doctor's office with 16 nails in your foot complaining of foot pain, and your doctor's got to evaluate and pull all the nails, because otherwise, a lot of what happens is they find one nail on a test, for example, they pull it out and say, come back in a month and tell me how you're feeling. So when we're dealing with the terrain, so number one, I'll first give you the model so you understand what we'll be discussing. Number one in the model, in fact, the first six I'm going to tell you about is what I call the six rivers of inflammation,
mm,
which go into an ocean of inflammation. So the six primary factors are number one, infections. We're going to break this down into A, bacteria, B, viruses, C, parasites, and D, fungus. Okay. Number two, environmental toxins. And that's going to affect your terrain. So most of the ones we'll be talking about today will be mold and heavy metals, but for the chemically sensitive people, there are people clearly who've been exposed to glyphosate and DDT. And I mean, the truth is we're exposed to, and the numbers are true, anywhere between hundreds to thousands of environmental toxins on a daily basis. So that is why if you ever came to my home and you came to my kitchen and you looked at all the supplements I'm swallowing, you might think I'm a sick person. And it's mostly because I just understand the biochemistry of the body and what's getting in and kind of how to
mm,
support and biohack my own biochemistry, right, to get these
mm,
toxins out. But number two is toxins. Numbers three and four, your gut. It depends on the microbiome. We now know that if you don't have enough short-chain fatty acid bacteria, there are certain healthy bacteria, F. proudnitzii, certain ones that we know you need to have, certain lactobacillus, bifidobacterium. Long COVID, for example, knocked out bifidobacterium in a certain population of people, made them sicker. We'll go into the vaccine issues later on with this. But if the microbiome is off because of the gut-brain liver axis, that is going to affect basically how your body responds. Because when you have the wrong bacteria in your gut, you're making these inflammatory molecules. You need fiber and prebiotics and things to get it there to get what are called short-chain fatty acid bacteria growing that are anti-inflammatory. Besides that terrain, you also have to look at leaky gut intestinal hyperpermeability, which sometimes is associated with mast cell activation. So this means that, and I have intestinal hyperpermeability myself, I've had it for years. My dad was a surgeon. Every time I got sick, my mother would yell, "Harris, give him a shot." And I would get antibiotics, and nobody thought to say, hey, take yogurt or probiotics. I got a candida problem later in life, and the candida caused some intestinal hyperpermeability. I've got to keep carbs down. I've taken, we'll go through later on how to heal the gut, but bovine immunoglobulins, SPI Protect, well, there's many that you can take. And I basically got it in order now where my asthma's gone because I got off my histamine foods, which was associated with my leaky gut. So numbers 3 and 4 are your gut, intestinal hypermobility, leaky gut, mast cell disorder, the wrong types of bacteria. Number 5 are vitamin and mineral deficiencies. The reason this is important is because most patients I test are mineral and vitamin deficient. And we asked before, how many people said, I think it was 44% that said the tests were normal. But what they might not have tested you for example, in your minerals, they might have checked a serum magnesium, but there are 300 detoxification enzymes in your body that need magnesium, and 99% is inside your cells. So if your doctor doesn't do a red blood cell magnesium, a red blood cell zinc, if you don't have enough zinc, your inflammatory profile goes off the wall. A red blood cell copper, you need copper for an enzyme called superoxide dismutase. If you don't have enough of that, you get too much free radical oxidative stress. That damages the mitochondria, right? It's a whole cycle. So you need to check not just B12, but methylmalonic acid. Some people have occult B12 deficiency. So that's number 5. And number 6 is sleep disorders. Now, in my patient population, most of my patients don't fall asleep and they keep waking up in the middle of the night. That's what Lyme and Bartonella does to you. But you also need to know that 10% of the population, even young, thin women, have sleep apnea. Men in their 60s, 70s, it may be benign prostatic hypertrophy interfering with sleep, or you're depressed and anxious keeping you up, or you're taking stimulants for your ADHD like Vyvanse that never gets out of your body and is in your body all day long, or you've drunk too much caffeine late in the day, or you've got restless leg syndrome. The point being, you don't just label the insomnia, throw drugs or herbs at it like gabapentin and melatonin and whatever. You've got to get to the cause of why it's there. So these 6 ones that I mentioned, infections, toxins, leaky gut with mast cell disorder, microbiome issues, vitamin minerals, and also sleep disorders are these 6 primary rivers of inflammation. And they cause 10 downstream effects of the inflammation, which is number 1, mitochondrial dysfunction, because the mitochondria have nothing protecting them from all this free radical. So most of our patients have the cell danger response. There's too much oxidative stress, the mitochondria are damaged. You'll never get better if we don't stop where the inflammation's coming from and heal the mitochondria. But the inflammation also goes to your brain and affects the hypothalamic pituitary axis. So men, in fact, the Canadian patient I spoke to who was in his 20s had low testosterone. He was being given testosterone gels and shots at his age instead of saying, oh, it was the Lyme and the Bart that was causing it, using tricks like Clomid or Arimidex because he still was young and wanted to have kids. Adrenal dysfunction. 99% of my patients have this. You see it with Lyme and Bart. You see it with long COVID. So the hormones get affected. A lot of the autonomic nervous system gets thrown off with POTS dysautonomia. So you stand up, you get dizzy, you feel like you're going to pass out or you do pass out, or your fatigue and brain fog and your anxiety is due to the POTS dysautonomia because Lyme, Bart, long COVID, and mold all cause POTS dysautonomia, right? And then you've got liver dysfunction, deconditioning, immune dysfunction, where your immune system, you actually get immunosuppressed from Lyme and Bartonella and mold and COVID with T cell exhaustion, or autoimmune syndromes come out with autoimmune issues. So there's all of these downstream effects. And the beauty of the 16-point MSIDS model is when you're sick, knowing you have a map, right? You got to go on a treasure hunt to figure out how to get to the end of the rainbow, right? To figure it out, get the pot of gold. I guarantee you, after seeing all these 13,000 sick patients in 41 years who failed multiple doctors, you will find the answers you're looking for generally on this map. And genetics, by the way, since we're talking about it today,
Hmm.
is absolutely part of the issue because
Yeah.
you may have, I don't even know if we discussed this last time, Krista, but some of my patients are fast metabolizers.
Yeah.
So we're giving them the drugs they need, but they're being pushed out of their system too fast. And they didn't bother to check their
Yeah.
genetic profiles to see whether they need higher doses of these drugs or pulsed in a different manner.
Yeah.
So that model, that is how we're going to talk about it. And the terrain is, again, how many toxins are getting in and what the
Mm.
microbiome, the gut is doing and how the hormones have been affected. That's all part of the terrain in your body that's been affected from the infections and the toxins that are coming right from the outside world.
Yeah. I like I like how you positioned especially those initial six in terms of that very much being a story not only of your own health experience with the world, but the story of your genetics in your body, because every person will have varying degrees of strength or weakness within that. So, for example, you spoke to from a gut integrity perspective, based on your mother and father who had the best of intentions. When you were little, you got shoveled full with all these antibiotics, which really disabled and shifted and set up a bad terrain in terms of gut and permeability. Whereas another person, for example, in terms of detoxification, maybe they have several deletions when it comes to their GST or the glutathione family. And so that is not a strong point, and they will always be a little bit weaker in that space.
Mhm.
I like that that model kind of invites questions in terms of your own health history story and then in terms of your genetic story, because every person's going to have different strengths and weaknesses within
And
those
and you know, and
six.
what's tricky with this is, so when I was in med school, I did my medical school training in Belgium for 7 years, and as you can imagine, there's 500 Belgian beers, and medical students like going out to bars. So I would drink one beer, and my head would be on the table, out to sleep, and they were
Mm.
making fun of me as like, "Oh, l'Américain, il ne peut pas boire les bières, c'est trop pour l'Américain," and it's like, it's not my fault. I'm hypoglycemic. My blood sugar's swinging, right? And I didn't
Yeah.
know. I mean,
Mhm.
I had no idea at the
Yep.
time I was hypoglycemic. Now I
Yep.
know. But for example, people that say who are listening, there's going to be many of you. You could raise your hands
Mhm.
afterwards. How many of you mid-morning, right, 10 o'clock in the morning after
Mm.
breakfast, an hour, or
Mm.
mid-afternoon, around 3 o'clock in the afternoon, you crash?
Mm.
It's like you think you're eating healthy, but all of a sudden you crash. Now, that may be a combination of adrenal, but what I've seen is adrenals with hypoglycemia cause a lot of this on top of candida. So sometimes when I'm really tired and I'm thinking, oh, it's the world, it's the stress in the world, it's this and that, it's
Yeah.
not. It's because I'm so sensitive to candida that if God forbid I should want to try and have a slice or two of pizza the night before and my carb load, and I'm
Mm.
not talking like really bad eating, my diet is usually very clean. I can't tolerate certain foods. I've just
Yeah.
learned like it's not worth it. But I've also
Yeah.
learned like, oh, when I think it's stress, I got to go back and go, is this
Mm.
candida?
Yeah.
Because interesting, we talked about Lyme, Bart, long COVID mold causing brain fog and fatigue, and but so does candida. Candida, I would say, is probably one of those hidden diseases that I didn't really learn it in med school as being
Yeah.
a real disease. It is. I mean, it
Hmm.
causes a lot of the same symptoms we see with Lyme and Bartonella and
Yep.
mold. It's on that differential diagnostic list. So for those
Yeah.
people listening, put that in the checkbox that makes sure you get your microbiome checked, you restrict your
Mm.
carbs, ask your doctor about it to see if you've got candida overgrowth in the gut. It was my
Yeah.
problem. I
Yeah.
I feel great as long as I'm off carbs, and my asthma is gone as long as I'm off histamine
Yeah.
foods.
Yeah.
Right? So
I love what you've brought in, and I want to sprinkle this ray of hope into the audience, in particular those who have been searching for their diagnosis and support and care for more than 10 years. Listen to the way that Dr. Horowitz is teaching or speaking insofar as it's one thing to do the initial work to clean up the train and solve for whatever it is going on, but there's always going to be this lifelong learning of I have a bit of an Achilles heel when it comes to my gut and when it comes to candida. And even if I figure out the cure to Lyme or whatever your issue might be, that's not going to absolve you from having to tend that element. And but then listening to you, you've learned to tune yourself so that when it's just peeking its teeny tiny head up, you're like, cool, I'm going to quash that quickly. I'm going to drive that snake out really quick.
Yeah. No, it's exactly that. And for me, that is my Achilles heel. It's hypoglycemia candida.
Yeah.
I've learned how important the diet is. I mean, carbs for me are my enemy.
Mm.
Basically, I'm a protein guy. I mean, I don't want to overdo the red meats. We do a little bit of fish. I'm concerned
Yeah.
about what's making it in, to microplastics and heavy metals. So instead of doing,
Yeah.
2 grams of mercury-free fish oil to get in my omega-3s, I'm getting in some, and I do a Mediterranean style diet because it's one of the best anti-inflammatory diets. But you've got to modify that diet. So my diet, is a Mediterranean style diet, but it's a hypoglycemic, low
Hmm.
histamine for, mast cell,
Yeah.
hypoglycemic candida Mediterranean diet. I mean, that's my personalized diet. I'm on my treadmill for roughly 20 minutes a day. I'm getting my 8 hours of
Yeah.
sleep. I'm doing everything I need to do, but the diet for me, it is absolutely my Achilles heel.
Yeah.
And I don't care how much itraconazole or fluconazole I've taken for candida, I cannot get my diet
Yeah.
to straight. I just know what my limitations are and I know how to
Yeah.
feel good.
Yeah. Yeah. And I think recognizing that is part of that healing journey insofar as this is what keeps me healthy in the long go of it.
Yeah.
Yeah. So I love that we've identified at least these spaces with which we can disrupt a terrain and make a terrain a little bit more susceptible to the proverbial snakes that are coming in. So can you talk to me about when, assuming exposure, right? If your body isn't exposed to Lyme or tick bite or whatever the agent might be, there's an element of we don't have to think about it, but once your body's been exposed, and I know you're already going to correct me and let the audience know that exposures happen a lot more than we care and want them to be happening. But once the exposure has been happening, talk to me how a dysregulated terrain or a terrain that isn't, in peak condition can invite that infection in to grab hold.
So for example, I have many patients, for example, that have gotten tick bites and gotten erythema migrans, rashes, had Lyme,
Yeah.
and they're just not that ill,
Hmm.
right? Now some of them, of course, may have taken antibiotics for an unrelated problem. They lowered the load of the spirochetes early on, so their immune system did not have too much to deal with. But essentially, what I found, and I mean, be clear with this: the sickest patients I've seen have at least 8 or 9 or 10 of those nails in the foot, those MSIDS factors I just described to you. But usually on the top of the list driving the inflammation is usually the three Bs, Borrelia, Babesia, Bartonella, right? In Canada specifically, you not only have Babesia microti and some Duncani, but you have a new kid on the block called Babesia oticolii. And when we test for it, we are finding it. And the way you know you have this is I have a questionnaire. And by the way, for those of you, it sounds like many of you know you probably have chronic Lyme on the call. But for those of you who don't, we validated a questionnaire years ago because you learn in medical school that 90% of all diagnosis is just taking a proper clinical history. You might be surprised how often this does not actually happen. So, what I did about 10 years ago with researchers from the State University of New Paltz is we had 1,600 people from 3 medical practices, and we validated a symptom questionnaire that was initially designed by Dr. Joseph Borscano, one of the giants of whose shoulders I've stood on. And it's on my website, cangetbetter.com. Just go under, I think it's learning, or you'll see it under there, and you can download the PDF. I call it the HMQ, the Horowitz MSIDS questionnaire, and you fill it out. And the beauty of it is, if you fill out, for example, questions 1 and 22, and again, you can have a show of hands, these are the symptoms of babesia: day sweats, night sweats, chills, sometimes shaking, flushing, an unexplained cough, or air hunger.
Mm.
So when a woman is not in menopause, and it's more complicated when she is, when the estrogen's down, because you can have menopause and babesia complicating the sweats. But let's say you're in your 20s and 30s and you've got mild sweats, moderate sweats, significant sweats. That's usually, and again, there's always a differential diagnosis. But once you've ruled out the other big ones, like you don't have hyperthyroidism, you're not in menopause, you don't have tuberculosis or non-Hodgkin's lymphoma, right? You're not losing weight, you don't have big hard lymph nodes. And by the way, in all of the books I've written, Why can't I get better? How can I get better? There's always a big section on differential diagnosis. In my new book that will be coming out in October called Ending Chronic Illness, I even extended it. I think it's 30 or 35 pages so that when you go on sweats and chills, you'll have all the boxes to check just to make sure it's not malaria, right? The things you have to rule out because it always goes back to differential diagnosis. But in my world, it's oftentimes Babesia because the ticks are now infected with Babesia, and they've shown that in fact, there was just an article published this week, my medical detective Substack tomorrow. For those of you who don't know, I have a Substack. It's free to sign up. It's called Medical Detective. Tomorrow we'll be dealing with Babesia, about that they're now finding that the Babesia are way more common in the ticks than they suspected. And basically, it just makes it worse because it's a parasitic infection on top of your bacterial infections with Lyme or Bartonella. And there's very specific ways of getting rid of it. But the point being, when you fill out the questionnaire, migratory pain tells you it's Lyme. Questions 1 and 22 suspects Babesia. So if you score over 63 on this questionnaire, there's a very high probability that you're suffering from chronic Lyme. And unfortunately, whether you're from Canada in your Canadian system or in the US, or if people are signing in from other places, the standard testing of indirect testing of an ELISA, a C6 ELISA, which checks for 3 strains of Lyme, Borrelia burgdorferi sensu stricto, Abzelai, and another Borrelia strain in Europe that causes neuroborreliosis. Those 3 strains are checked on a C6 ELISA. Sometimes if the ELISA is negative, the C6 is positive. But also you can do an immunofluorescent assay. And I love the immunoblot from IGeneX because it's checking 9 strains and it's FDA approved. But the point being, if you suspect it and one test is negative and it's migratory pain, or you've got these sweats and people can't tell you your thyroids are fine and you're not in menopause, you got to go after the testing because local Babesia testing with Microti duncani will not pick up Otocolii. And a lot of my patients are immunosuppressed, so they need an RNA test called a FISH test, fluorescent in situ hybridization from either IGeneX or T-Labs. So if you're sick, and again, this is in a lot of the stuff I published and in my books, you've got to know the testing to do, but don't give up. The point is, there's always going to be an underlying reason, but these infections, when combined with mold, and I wrote a Substack maybe 2 months ago on the mysterious Canadian brain disease that's affecting now about 500 or 600 Canadians. And I was on a call this past week on the Zoom to help them, gratis just say, how can I help you? I talked to them about the likelihood of tick-borne infections because the St. Lawrence River, where they're living, is overflowing all the time, causing moldy homes. And no one has checked these people for mycotoxins from a lab like Real-Time Laboratories or done immunoblots for Lyme, Babesia, Bartonella from IGeneX. They're not even thinking about it in the Canadian system. There are answers. And I will tell you, these things are much more frequent than you might suggest. I mean, it's not just because I'm a Lyme doctor that I think everybody's walking around. They usually say if you're a hammer, everyone's a nail. These diseases have really spread far and wide. They are in full epidemic proportion. So you are going to have leaky gut like I had. You're probably going to have the wrong microbiome and oftentimes have mast cell. And the way you know you have mast cell is if you eat something, smell something, or touch something, and you get an immediate reaction with sneezing, itching, wheezing, nasal congestion, asthma symptoms. A lot of times that's histamine release basically from mast cell activation. These are really common things, just as is POTS dysautonomia. Like all these people who've gotten Lyme, BART, mold, and long COVID, their autonomic nervous system's not working, so they have low blood pressure. They stand up, they get brain fog because they're not perfusing their brain, even if they don't have Lyme and Bartonella. The point being, the 16-point model will get to the cause if you just don't give up and understand the testing you need to do to keep going back to figure it out.
Yeah. Yeah. I like, and I want to be encouraging of the audience. Sometimes it's difficult to say, okay, I think it's Lyme, but finding a practitioner that is able to support that. So I think the really great thing that Dr. Horowitz has done here is empowered you with that questionnaire, empowered you with different books, and so that you can start that journey. And obviously that journey is going to need a companion of a doctor who's able to prescribe and monitor and not give up and support you in particular in moments where you don't think you're going to find that finish line. But leverage the resources that do exist so that you're able to continue that journey until you find that provider who's able to walk that walk with you, right?
Mhm.
It's not meant to be something where you give up. It's meant to be something you advocate for yourself, which is a sad thing when you are not feeling well, but that you continue to advocate for yourself so that you do find that betterness, and it's not taking, unfortunately, the 10 or so years that so many people on this call are speaking to. Yeah.
And, I'm not sure in the Canadian health system who you call. I know in BC, the naturopaths are able to prescribe. I spoke to one
Yeah.
today who's excellent. But, ilads.org, the organization I founded over 25 years ago, they've generally got doctors that have been trained in the protocols. And I've trained
Yeah.
hundreds and hundreds of doctors in this MSIDS protocol and
Yeah.
Dapsone therapy that we'll discuss. So there are people out there that are doing this, right?
Yeah.
And all of my protocols are published for free online.
Hmm.
Microorganisms, April 2023, microorganisms 2024. Actually, it was September 2023 and April 2024. The entire Dapsone protocol in detail is published. My medical detective Substacks took it again and did it in detail that way you can work with your doctor. So it's out there. You just have to find a practitioner. There's compassionate, smart practitioners out there. You've just, most of the time, by the way, the ones who followed the model I'm talking about today, they've had Lyme themselves. Their family has had it.
Yeah.
Unfortunately, that's how they've kind of back-ended a lot of times into this.
Yeah. Yeah. I know within DNA Company, we have a clinic that we see patients through. And so some of the initial testing can be done there. And it's a lot of collaborative care after the fact. And within the Canadian model that you've alluded to, if there are fellow Canucks on the call, oftentimes if you're outside of BC naturopaths have incredible prescribing rights. Oftentimes, it then becomes an element of collaborative care. A naturopath who's so well versed in different terrain and herbs, working with an MD who's so beautifully well versed in different antimicrobial drugs and protocols there. Yeah.
Yeah.
Yeah. So let's talk through. So someone comes in with a bit of a dysregulated terrain, and unfortunately, based on climate change and based on different toxic exposures that further encourage some of this mold and other things to take root, someone has these conditions and we see it bubbling up, and we're starting to catch it through testing. Talk to me about how there's a two-pronged approach. There's one prong in terms of addressing what exactly is causing, right? That protocol that will address whatever is the infecting agent, but then also protocols down the road to balance out and support the terrain. Because once that organism is in there, if I'm understanding it correctly, it's wreaking havoc and it's further disrupting the terrain that was already weak and allowed it to come in and grab hold.
Right. So because it's against St. Patrick's and we're talking about driving out the snakes, so the way I've learned
Mm-hmm.
to drive out the spirochetes is, and this is really an issue that we only learned about in the last 10 years from universities like Johns Hopkins University,
Mm-hmm.
Stanford, University of New Haven, Kim Lewis's lab, Northeastern. Lyme and Bartonella are what are called biofilm persister bacteria.
Mm-hmm.
And the reason this is important that you understand this is because when you use standard antibiotics against bacteria that are biofilm persisters like TB and leprosy, those require multiple drug regimens to get you better. And in
Yeah.
leprosy's case, it's 6 months to 12 months. For TB, it's the same. If
Yeah.
it's multi-drug resistant, it's even more. I have figured out, having done this now in the last 10 years, playing with these biofilm persister protocols, what I did is once I learned that Lyme was a persister bacteria with biofilms, I simply went back to my training from when I was in residency 41 years ago. Actually, it was 43 years ago. I did this with the HIV population. They were coming in with TB. They came with Mycobacterium avium intracellulare in their lungs. They actually came in with tuberculosis. One of my mentors was an infectious disease doctor. I got used to using things like INH, rifampin, pyrazinamide. I was waiting for an excuse. And I published my first article on this in 2016, 10 years ago, on using Dapsone because rifampin and Dapsone is used to treat leprosy and cure it.
Yeah.
I knew when I looked at the effects of Dapsone as a drug, great penetration into the brain. I have not had to use any more IV Rocephin. It hits autoimmune systems. So if you have autoimmunity, it's used for autoimmune diseases like Behçet syndrome. It's anti-inflammatory. It affects an enzyme called myeloperoxidase inside the white cells and takes down inflammation. Inflammation, as you're hearing today, is underlying all the chronic manifestations, by the way, of every disease we'll talk about that's a chronic illness. It also is a persister drug. and it has some effects on Babesia. It's got anti-malarial properties. So when I looked at the drug, I said, it's almost too good to be true. All I did was add doxycycline or minocycline to rifampin and dapsone used to cure leprosy. It was a home run out of the park the first time I tried it. I just it took me several years to figure out the dose and how long to give it for, but I got it down to 9 weeks. That people only have to take the protocol for a 9-week protocol, stop it. And the way we protect your terrain is I designed the protocol with 4 different probiotics of a total of 500 billion twice a day, orthobiotic, Theralac from Master Supplements, Probiomax 350 billion with 18 different acid-resistant strains to get into your lower colon with Saccharomyces boulardii, which stops C. diff diarrhea. So first, I'm protecting your gut. You're on a very low-carb Mediterranean diet. I'm protecting you from the side effects of Dapsone by giving you ridiculous doses of folic acid, because one of the side effects of Dapsone is it causes folic acid deficiency. It interferes with the bone marrow. And I'm giving you things like methylene blue, which help lower one of the side effects of Dapsone, methemoglobinemia, while I'm also giving you high-dose glutathione, which lowers methemoglobinemia with NAC and alpha-lipoic acid, because NAC, alpha-lipoic acid, and glutathione block the first major inflammatory pathway inside the cells called NF-kappa B. So this protocol, the reason people are on 70 supplements, and I'm not exaggerating, it's probably about 70, is I am blocking every inflammatory pathway which way. I'm stimulating NRF2 with curcumin and broccoli seed extract. I'm blocking NLRP3 inflammasomes in the brain, which also, by the way, Dapsone does, which is why the brain fog gets better when you take Dapsone. So I designed the protocol based on the biochemistry of inflammation and protecting, right? So that when people come off the protocol, the microbiome, right, is not a mess, and they continue the probiotics for months afterwards to make sure they've seeded it. We replace them the folic acid when they're done. So the count, by the way, the blood counts, everything comes back to normal when you're done. So basically it took me 10 years to tweak this protocol to get it to a short-term protocol. And with Bartonella, it's 2-week pulses with it's literally 13 days of antibiotics. And understand, these are not easy regimens. I mean, I tell people this regimen's like cancer chemotherapy. If you had non-Hodgkin's lymphoma and they said to you, you had a 95% success rate with something called CHOP, you would do it, even though you would risk brain fog, chemotherapy, brain fog, and even neuropathy from the chemotherapy. The beauty of Dapsone therapy is there is no long-term brain fog. In fact, your brain fog is the number one symptom that gets better. And there's no long-term neuropathy because Dapsone helps neuropathy for the people out there that say, I have resistant tingling, numbness, burning, stabbing, vibration senses. Dapsone helps with it also. And I have a new article that will be published hopefully in the next 2 or 3 weeks in the Journal of Alzheimer's Disease Case Studies. This is, for me, mind-blowing. Listen carefully. I discovered that when I started doing Alzheimer's biomarkers in this chronic Lyme population, beta amyloid 4240, p-tau 181, p-tau 217, neurofilament light, occasionally checking ApoE to see if you actually had genetic Alzheimer's. Roughly in my patient population with brain fog, 50% of the people were testing positive for these Alzheimer's biomarkers. Now be clear, this does not mean you're going to go on and have Alzheimer's. But what it does mean, you've got inflammation going on in your brain. I gave this woman, because I finished clinical practice and everybody did Dapsone, I had this one woman who had never done Dapsone therapy, and she was the perfect chronic Lyme post-treatment Lyme disease syndrome because she had an EM rash 15 years ago, ELISA positive, C6 ELISA positive, IgM Western blot CDC positive, IgG Western blot CDC positive, IgG immunoblot. She met every criteria, and she had p-tau 217 elevated. This means 15 years from now, there's a big chance of dementia. And her rheumatoid factors were positive without having rheumatoid arthritis. I gave her the 9-week Dapsone protocol. She was sick for 15 years. 3 months post-Dapsone, the rheumatoid factors are normal, and her p-tau 217 went into normal range. Now, for you to understand the significance of this, when I did a deep dive in the medical literature, I discovered that roughly 25% of the Alzheimer's cases out there, they believe are due to Borrelia burgdorferi Lyme and or Denticola spirochetes, because we're talking about driving out the snakes.
Yeah.
that have gotten into the brain, causing amyloid production and p-tau, phosphorylated tau
Yeah.
in the brain. I reversed it. Now, again, it's one case study. But do you realize what hope this gives? This means that every Lyme doctor out there, where a patient says, I have brain fog, who now checks these biomarkers, you may now have a way of protecting your brain. I'm not claiming we do yet. I'm just claiming it's exciting from my standpoint because no one's ever published it. Look out for this on my Facebook page, Journal of Alzheimer's Disease Case Studies. They accepted the case study with some revisions. I gave in the revisions. They're supposed to, tomorrow is 3 weeks out. I should be hearing back.
Mm.
But this is now a new way of saying, hey, my brain's not working. Can I even protect it even more?
Yeah.
Because Dapsone has wonderful penetration and we're reversing. And this is all based on Eva Shapy's work that about 4 years ago they discovered that Lyme in the brain, this is in autopsies, was associated with biofilm, amyloid, and p-tau. And the reason you made amyloid in the brain is because your brain was trying to protect you from the spirochetes. The amyloid was anti-inflammatory. It was like going after it to protect you. But of course, it was doing the opposite. We may now have a new protocol, not lecanemab, the monoclonal antibody that shrinks your brain and can give you brain bleeds that doesn't really change the course of Alzheimer's, not memantine, Namenda, not acetylcholinesterase inhibitors, but actual things that get to the bottom of why people are having these brain fog symptoms. And what I discovered, which again is in my new book, Ending Chronic Illness, is that all 16 MSIDS factors underlying Alzheimer's disease. And this is in the article I'm about to publish. This is big news because all your doctors are doing is they're labeling it as you have Alzheimer's and giving you a death sentence. And guess what? It's not the case. Doctors need to learn to stop naming diseases and throwing drugs at it and looking at these 16 underlying inflammatory factors. So for me, this may be one of the most exciting things I've discovered because of the implications, because they're now suggesting that 42% of the population over 55 years old, this is in the article, according to the medical literature, is going on to dementia. In the US, we had 46.5 million Americans with preclinical dementia. You'd think the health departments at our HHS would be looking at this going, oh my God, what can we do here?
Yeah.
I'm not saying I have a full answer, but I'm saying I have, en français, les pistes. Les choses qu'on va voir, peut-être des pistes qu'on peut examiner, the things we need to look at carefully, that I believe are going to give us new ways forward in health.
Yeah.
It's really an exciting time to give you hope in ways that I never thought I'd be able to help people. So, even though I stopped doing one-on-one clinical practice and I'm now doing consultation medicine, this article was one of my last articles to publish when I was doing one-on-one, and it's really exciting stuff.
Yeah. I think I hear so much power in what you're saying because historically we thought of things like Alzheimer's, to your point, we diagnose things and then we're like, shoot, that's a static label, and we aren't able to engage with a label. It's just a process that maybe we can slow down that process. There's so much power in what you are talking about in terms of screening before we even think to screen, right? Historically, we would have thought about screening for dementia, once symptoms started to percolate up, as opposed to proactive screening. But now to say you're empowered to halt, potentially reverse, right? We had in our webinars, we talk often around how diet and lifestyle can really reverse some of the symptomology. And now we're hearing even before it presents, this is the body's best effort to support itself in its current state. And if we fix the current state, which are all those little proverbial snakes in the body, there's an ability to take a step back and not take that course towards Alzheimer's. It's a label that we can interact with. It's no longer this
Yes.
static thing.
And by the way, I'm reading the messages as we're coming
Yeah.
in. One of the persons asked about Bartonella, if you can take Dapsone, and be clear,
Yeah.
since it's also a biofilm persister bacteria, what came out of Hopkins is that Zithromax, methylene blue, combined with rifampin, hits the biofilm persister forms of Bartonella. So I have had patients, for example, where I've not used Dapsone. For me, the Dapsone is the most effective, but can you lower the load of the bacteria without? The answer is absolutely yes. I've even had people that have done 1 2-week pulse with 6 days of Dapsone without even doing the 9-week Dapsone protocol with Bart Fish positive, who said, oh my God, I'm 40% better. And they didn't even want to go on and do more treatment until I checked their dementia markers. I checked the Alzheimer's markers and the p-tau
Mm.
181 was high. This is a 50-year-old woman. And I said, you're a professor at a university. I know you feel better from doing the 2-week pulse. You've got to keep going.
Yeah.
But the answer to the person who asked that question is yes. And I put my consulting services in your chat box. Please understand, I am not looking for work. I'm not joking. I'm being very serious with you. I retired after 41 years of practice, and I'm getting calls from all over the world, from Australia to New Zealand, all over. I'm here to help, but try and access all the open access things I've done, which is publish my stuff open access before you ask me to help. Try and get your doctor to read the literature, read my medical detective Substacks, read my books before you contact me, because I've really put out all my secrets. I'm not holding on to anything. Most of what I do in this consultation service is I am tweaking things for doctors who know a lot, but sometimes need some tweaking,
Yeah.
or maybe left off an adrenal test or a mole test and didn't think of it. So please be aware. I'm out there for you in the consulting service, but you have to have a doctor who's going to be using my recommendations to diagnose and prescribe. And please try and you get them to do it first before you call me, because my wife would like to have a life with me going forward. And I'm getting way more requests
Yeah.
for the consults than expected. I don't know what I was thinking when I moved over to this consult model.
Yeah, yeah. What we might do, Dr. Horowitz, at some point in time, if you're open to it, is have you into our practitioner-facing webinars so that you can very clearly outline, here are the resources, here's where you can do the training. And this is why, even though people who are on this webinar audience, it's really important that you hear this. Your doctor, the people that you are working with, the people that you trust and that have started down the right pathway but maybe need guidance, that guidance, as mentioned, is fully there, both within Dr. Horowitz's work and then additional, I'll say, within our work at the DNA company in terms of genetic things that are going to make strengths and weaknesses within those 6 sources of, or 16, but in particular 6 places where the terrain can become askew, and to that end of always wanting to stay healthy once you have actually solved it. You've done the Dapsone or whatever protocol it might be, to that end of wanting to keep that terrain happy and healthy. It is there. It's just a matter of continuing to advocate for yourself and pull in your provider to that advocating.
Yeah.
Yeah.
And what I'm doing is I'm putting in the chat now.
Hmm.
Um, I don't know why it's not pasting. Let's see.
Hmm.
Did it go through?
I haven't seen it yet, but if you want to,
I was doing the medical
yeah.
detective sub because the medical
Oh,
detective
we
Substacks.
we posted that for you. Yes, we
Okay.
have posted that link.
Someone was
And
asking, where do you get access to, like,
yeah,
where's and it's in the published articles that I've done, but it's also in the Substacks where I'm laying it out for doctors and patients piece by piece, so a doctor can read it and know exactly what to do for the patient without having to contact me.
yeah, yeah, yeah. Which, on behalf of doctors that seek to do well in the world, thank you. I value when something is just there as opposed to behind several million different paywalls and obfuscated in ways that don't support it. Yeah. So I think we've gotten to a point where perhaps we jump into our questions and answers, because audience, we teased, please put your questions and answers in and we are going to get to them. So Dr. Horowitz, I think that's where we do this transition over. Before we jump into specific questions, is there anything that you wanted to share with the audience before, any closing thoughts before?
No, the only thing I just want to point out, and this is a discovery I made when I started writing my new book. When I started writing this book, and Simon and Schuster gave me the ability to do this, I knew that long COVID had all 16 MSIDS factors associated with it. Someone asked about this. I knew, of course, Lyme did. I did a search on Alzheimer's, which I presented to Simon and Schuster, and 16 factors. So they said, okay. I then did a deep dive in the medical literature for the last year while I was writing this book. And what you need to know, and this is really important, is I discovered that every major chronic disease, and the book has a section called the ABCs of Chronic Disease Medicine, from ADD, ADHD, autism spectrum disorder, Alzheimer's, allergies, asthma, the 3 Bs, the C, cancer, cardiovascular disease, chronic fatigue syndrome, fibromyalgia, D, digestive disorders, inflammatory bowel, GERD, functional medicine disorders, hormonal disorders, sleep disorders, pain disorders. It didn't matter what disease I was looking at, all 16 MSIDS factors So that means when you're listening and you're saying, well, I don't have Lyme, maybe I have mold toxins or I have fibromyalgia, and you got the fibromyalgia or the chronic fatigue from an Epstein-Barr virus reactivation or HHV6 reactivation. And that was true. And that's what made you sick years ago. That's where the inflammation started. But as you heard from today, the terrain was affected. Maybe the microbiome was contributing and too many toxins got in and your detox pathways weren't working. Your genetics were off. The point I'm making here is that no matter what you're naming the disease, if you go back to the 16-point MSIDS model, and this is going to be outlined in my new book in detail, with natural techniques, functional medicine techniques, supplements, also pharmaceuticals, of course, and also diagnostics, as well as diet, sleep, exercise. It's all laid out. But the point being, it's kind of like I discovered something I didn't think I was going to discover, which is I'm not a MAHA person in the United States, but what I think they're looking for ultimately is they want to change the way we're doing chronic disease medicine. Yeah. The way we're doing medicine is not working, naming a disease and throwing drugs at it. What I ultimately discovered is, to my surprise, is that every major chronic disease just about, I'm sure there are some that don't have it, but all the big ones I was looking at, they all, including mood disorders with major depression, anxiety, they had all 16 MSIDS factors, from the microbiome to toxins getting into infections. So even if you were depressed and anxious because you had a lousy childhood and you had trauma, which at least half of my patients have had, and they need to do limbic and vagal retraining, absolutely. What they don't realize is the gut-brain interaxis from the microbiome or the toxins that get in from the mold was making the depression worse. And then the Lyme and Bark came along. So it's not that the trauma didn't make you depressed and anxious. It did. It threw off your limbic system and your vagal responses. But you got to still go back to the 16 points. So what I'm telling you here is there is hope that whether you are naming the disease, whatever it is, please go back. The book will be out in October of this year. It's, for me, maybe the most important thing I've ever put out there, apart from this Alzheimer's article, because it's something I did not expect to find, which is, oh my God, all 16 factors are underlying all these chronic illnesses. We now have a new way of both prevention. Let's say you've got cancer in your family like I do. I have no one left. Everyone is dead. That is why I'm swallowing a lot of these supplements and, doing what I'm doing for my health. Cancer, all 16 MSIDS factors. And by the way, I've written a lot of this on the Medical Detective Substacks, that you'll actually see the 16 points with Parkinson's, with cancer, with autism. I've already written these so you can actually get a preview. But it means you have hope. It means that even if you've been sick and no one's been able to figure out what are the missing pieces, please go to the MSIDS model. And again, it was published in Healthcare in 2018. It was published, my last book, How Can I Get Better, has it, as do many of the articles I published, which are free to access online if you just look them up.
Yeah, yeah. I've had a similar experience insofar as a naturopath, I tend to get a lot of Hail Mary cases, insofar as like people like, I've seen everyone, maybe the witch doctor can help. And what I always found amazing, and this is more to the end of genetic testing. So our DNA 360 looks at systems that found the body. So systems of inflammation, systems of metabolism, systems of hormones. And none of these genes that we look at are disease defining, meaning none of our genes correlate and say you will or will not have this disease. Instead, they curate how well do you methylate? How well do you detox? How do you handle your sugars? Things of that nature. And I found starting there and cleaning up a person's base will get them to the point where, because they're removing some other offending factors, we can better dive into what exactly is causing the issue and address the issue a little bit more head on. So I like that, Dr. Horowitz, you and I have both kind of come to a similar awareness through different vehicles, but all to the end of, by cleaning up the way you eat and sleep and really focusing in on truly what is wrong, you can get to that picture of health, sustainable health at that.
Yeah. A couple of questions came up. How do you assess inflammation? What's going on with the jabs, with the messenger RNA and long COVID? So let me just tell you about, let me start with long COVID.
Yeah.
Long COVID has all 16 factors associated with it. There's absolutely no doubt that some people got sick from spike proteins. Yeah. Understand the spike proteins can get into your body, whether you got COVID itself or whether you got the messenger RNA vaccine, which definitely made more spike proteins, no doubt about it. But my understanding of the terrain, since you have to understand the terrain and why some people get COVID and don't get long COVID, Most of the patients that I've sent to Bruce Patterson's lab from Radiance Diagnostics and have done this, the chemokine and cytokine panels, and we're looking at TNF alpha and IL-1 and IL-6 and IL-13 and VEGF, vascular endothelial growth factor, which implies the spike protein is sitting in your vasculature and it's driving VEGF. It turns out in a lot of the patients that have failed Maraviroc and Pravastatin, which Bruce is talking about as a possible way of doing it, and none of the protocols of spike protein detoxification have yet been published that they work. What I am finding is the VEGF was from Bartonella. And that many of these people, even if they never got Lyme, almost every person I now know has been exposed to Bartonella. It seems like it was like the silent infection that got into everybody from cat scratches, cat bites. I mean, I'm not a cat person, I'm a dog person. But at Northwestern, I took care of stray cats. We had stray cats. I was feeding them. They were coming inside. I was itching because I'm allergic to, I couldn't care. I'm an animal person. So we've all been exposed to it. But if your immune system is strong and your terrain is working properly, you're not going to get chronic Bartonellosis. What I noticed from the people with long COVID is when we went through the 16-point MSIDS and we addressed the BART and we addressed the microbiome and we treated their Lyme and we pulled out their mold and we did this, including, by the way, the viral reactivation that did happen from Epstein-Barr and herpes virus 6. And by the way, I found a new protocol for Epstein-Barr, which I discuss in the book. It's not yet gone through clinical trials, but I'm almost certain it's going to work. And it's using persantine with spironolactone with Famvir. What I discovered is there are drugs we've been using in medicine for years. So, for example, EBV variants are now associated with multiple sclerosis. They're basically out there saying, hey, it's toxins causing MS, but demyelination is demyelination. Lyme causes demyelination, BART causes demyelination, toxins like mold cause, there's many causes of demyelination. So MS, there's true MS out there. But most of the cases I saw were Lyme, BART, mold, demyelination, looking like MS, or in the MS cases that didn't get better, the demyelination was being driven by these other factors. Well, it turns out in those ones that Epstein-Barr is driving it, when you use drugs like persantine that they used to use for stopping TIAs, transient ischemic attacks, and spironolactone that they use for women with polycystic ovarian syndrome, it hits the Epstein-Barr virus at different forms because Epstein-Barr goes dormant, it hides, and it reactivates from time to time. From the literature I did, which is in my new book, Ending Chronic Illness, it looks like when you combine it with famciclovir, and these are all benign drugs. I've used these drugs for years. I need a randomized trial, but I will tell you, based on the information, my gut, and usually my gut's pretty good, I may have found a way without really bad, horrible antiviral drugs that probably will put the EBV back in remission. I am going to need, obviously, a long study to do this. But to answer your question about the spike proteins, I believe it's the terrain and it's the 16M based on what I have treated in people. It's not just a spike protein got in there and made you sick. It was the terrain. It was the mold. It was all these other things. And be careful, because if the VEGF was high, it may not just be from spike proteins in the vasculature driving vascular endothelial growth factor. It's Bartonella that actually reactivated with the viruses and the rest of it. Regarding testing inflammation, I have a whole section of my new book on this. And there's 3 levels I discuss in the book of everything from CRPs to SED rates to VEGF, like the basic markers you can get. And then the really specific markers like what Bruce Patterson does through Radiance, looking at chemokines and cytokines. I break this down in the book, but you know this, Krista, you can't, even when you see signs of inflammation, like CRP is an indirect marker of IL-6, which can happen from Lyme and BART and mold and the rest. It doesn't tell you where it's coming from. It just tells you you've got inflammation. So the problem still is when you test for inflammation, you still basically have to go back to the 16-point MSIDS model to figure out where it's coming from.
Yeah. And that's where, if you're a doctor on the call, because I've been watching the chat as well, there's several doctors on the call, or you're a patient on the call, educating yourself, becoming an advocate for yourself, in particular, bringing this forward to your doctor or bringing it forward to someone here at DNA Company. We are very happy to support and see you, right? Bringing it forward to people who are informed and willing to do that thinking level of, if I've been seeing these markers, if I've done this thorough intake, here's where I go it. Yeah.
The issue of intergenerational extended family, autoimmune, ME/CFS, autism spectrum, dementia, underlying cause, the epiphany I got from writing ending chronic illness is that all 16 MSIDS factors are associated. So in my family with cancers, I'm
Mhm.
Ashkenazi, my family came from Eastern Europe, right? Some from Poland, some from Russia. They're Ashkenazi Jews. There's BRCA mutations that, Krista can talk to you about that she can check for in her DNA. But in my family, they also grew up in Brooklyn. They grew up in areas that were heavily polluted. They were all smokers. Nobody knew at the time.
Yeah.
So basically, I have certain risk factors in my genetics, but
Mhm.
by exercising every day,
Mhm.
by keeping down my sugars, right, by keeping down my insulin spikes, there are things you can do to check it. But getting to why people have autoimmunity and all the stuff, go back to the 16-point MSIDS, because whether I looked at autism or Alzheimer's or cancer or ME, chronic fatigue, all 16 MSIDS factors showed up in every one of these. You're going to see it in the new book when it comes out. The book is 640 pages, by the way.
Yeah.
I have roughly 2,000 scientific references backing this up. The publisher, Simon and Schuster, said, "We're not putting this in the book. You're going to put all the stuff on your website because there's no place to print it in
Yeah.
this book." So you'll see all of it. But basically, that is the answer to this. And I'm seeing some people, DNA testing found you don't detox very well, don't absorb
Yeah.
vitamin D and B12. I mean, that's the beauty of these genetic tests, right? Is finding out when you
Yeah.
don't absorb well, right? And
Yeah.
when you need to maybe using, in some cases, superhuman doses of this to get this to absorb.
Yeah.
Someone asked about demyelination from Bartonella and not in combination with heavy metals. Absolutely. That's what people are missing. Heavy metals are showing in most of us. Mold toxins are showing up in 90% of my patients. Lyme-Bartonella is common. So if you have any form of demyelination, whether they're calling it chronic inflammatory demyelinating polyneuropathy, CIDP,
Mhm.
very fancy name, it's seen with Lyme and Bart and mold. So you have to look at where's the demyelination coming from. Is it your diabetes? Is it
Yeah.
hypothyroidism? There are other things that cause demyelination, but in the world we're living in, the toxins like metals like mercury, lead, arsenic, they cause demyelination, they cause neuropathy. You mix that with mold, you mix that with Bard and Lyme, you mix that with the wrong microbiome where you don't have enough short chain fatty acids with leaky gut, right? Driving inflammation and you're not sleeping. It's just driving an inflammatory response. So whatever the name of your demyelinating disease, the beauty of this is you can go backwards and look at where the demyelination is coming from and don't just address one thing and certainly just say, take gabapentin for your neuropathy or take, duloxetine, Cymbalta or Elavil or even IVIG. Yes, helpful for neuropathy, but why is the neuropathy there? In my
Yeah.
world, it's never one thing. It's Lyme, it's Bart, it's mold, it's metals. And I think this multi-systemic idea of it's not one cause, one disease. We need to start thinking out of the box that this is multifactorial. And that's the 16-point MSIDS, MSIDS. That's what this model tells you. Let's go to all of this.
Yeah.
And I will tell you now that it's 41 years, 13,000, it works for the vast
Yeah.
majority. It's not to say I've had a 100% success rate, but I can pretty much count, honestly, probably on both hands. Maybe I've had 10 patients in all my
Yeah.
years that were just horrible resistant. And even they, little bits of improvement, nothing what I wanted.
Yeah.
And
Yeah.
when I was finishing practice, one of them got rid of his Lyme Babesia Bart. He went through all the Dapsone protocols, but the mold levels were just off the wall, and I didn't have a chance to detox him. He's now trying SOT therapies and, I mean, doing a whole bunch of other stuff to get rid of it. But the point being, there are always answers if you just
Yeah.
know to look, and that's the beauty of the MSIDS model.
And I think interestingly, and I'm speaking especially to those people who have been 4+ years searching for this. We've heard a lot around different trains, different infections, different things can coalesce and effectively create very similar disease pictures. But I want to make sure the audience hears that the flip of this is true. Healing, that also means, can come from many little different points. It's not all, it likely will require some large antibiotic protocol, but additional to that, very accessible things have healing properties. So just like your disease took, death by 1,000 cuts, healing is going to take little pathways back. And that is so very important because so many of those pathways right now are accessible to you as you find your way to a provider that can explain your different infectious panels, your immune panels, your DNA panels, whatever panel it might be. As you find your way there, there are points to start. And I think that's really important for people to hear. It may have taken 10 years, but you're that much closer now. So please don't give up.
Yeah.
Yeah.
I will be speaking at ILADS. I did submit the abstract based on the Alzheimer's case study that I
Oh,
submitted that
wonderful.
I'm hoping will be out in the next 3 weeks. I got to call the editor of the journal to see what they're doing
Hmm.
because I'm a reviewer for their other journal. Like I
There
get
you
my reviews done in
go.
days. What's taking you people so
Yeah.
long? Regarding the book being translated into German, interesting you ask, because I just did a webinar with Dietrich Klinkhardt and I asked him, uh,
Ah,
the book's being translated into Chinese, by the way.
okay. All right. So
Yeah,
German
I
isn't a
was
far
in.
cry.
Well, I was invited by the Chinese government. This is a great story. I was in Toulouse, France,
Oh.
speaking in French at an infectious disease conference. The only time, by the way, I've ever spoken to les infectiologues was in French in
Yep.
Toulouse. I get a call from the Chinese government that they think they're discovering babesia. I
Mm,
thought it was a hoax. They
sure.
actually flew us first class to Beijing without having our passport stamped. We did not have a way to get in. They stamped our passports and got us through. And I was there in China for about
Oh,
10 days at the invitation of the Chinese government. And I was with
oh,
their
amazing.
CDC, their
Yeah.
National Academy of Sciences. And we had
Yeah.
day after lectures and Q&A. I will tell you, it was fabulous. I think it's probably why they decided to translate the book. I mean,
Makes
a
sense.
billion plus people in China. I don't even know how many people are
Yeah.
going to be reading this book, but yeah, so
It's
I've asked for
important.
it to be translated into French. I've
Mm,
asked for it to be translated into German. I
okay.
mean, we'll see what happens. Hemochromatosis and leaky gut, not exactly. Hemochromatosis is more throwing off. That's brown diabetes. That's more like, affecting your liver can get cirrhosis and get
Mm,
hepatitis and liver cancer from it. And I mean, you got to really make sure you're getting the blood out and your
okay.
ferritin levels are down. But it's not that leaky gut and NASH, non-alcoholic steatohepatitis. I mean, 1/3 of the world's population now has fatty liver. You do not want to have fatty liver, which causes insulin resistance with glucose intolerance and have hemochromatosis. But most people who know they have hemochromatosis are going for bloodletting, every couple of months to get their
Hmm.
ferritin levels down. But but if you had leaky gut, it doesn't cause leaky gut. But if you had leaky gut, it would cause obviously more of an inflammatory response in the body, but it doesn't actually cause it. And the mole test that I'm using that I love is from Real Time Laboratories in Texas. Mosaic labs and other labs are out there that do antibody testing, but I've trained with Neil Nathan. I like seeing the amount that's actually in the body. I do a 2,000 milligram glutathione oral 1 hour before doing the test, drinking an 8-ounce glass of water every 15 minutes, get in a sauna for 15 to 20 minutes with a light sweat. Just
Yeah.
be careful if you have POTS dysautonomia, like the Canadian person I spoke to earlier today. But that's how I do it. And honestly, I'm getting like a 90% rate that everyone's exposed. Now, it
Yeah.
doesn't mean because you've been exposed, you're necessarily ill. And I should also tell you, it's the same thing with any of these MSIDS factors. I have people that have, they have mold and they're not sick from the mold. Like
Mhm.
I was exposed to mold and never got sick from it.
Yeah.
But I'm
Yeah.
also on ridiculous doses of detoxification every day. I'm aiming for 108
Yeah.
years old.
I love it.
It's a
I love
sacred
it.
number in the Tibetan tradition. It's a whole other issue. But
Yeah.
I'm aiming for another, 48 years of my life,
Yeah.
48, 38 at this point. And I'm doing everything I can to lower inflammation and be healthy. But the mycotoxin testing, I was exposed, my wife is exposed, but we never got sick from it. So understand, even when you test positive for something, it doesn't mean it's the major cause. Just like I've had patients test positive for low adrenal function with horrible adrenal dysfunction who had active
Mm,
Lyme, active BART, loads of other issues, but when their adrenals were treated, they went from like 0 to 90%,
mm,
even though they had Lyme and BART and mold. And it was like the adrenal was the biggest nail in their
yeah.
foot, making them sick. So understand that not all nails are equal, and you're not going to know until you actually go in there and treat whether every factor you find is actually the major ones causing illness.
Yeah.
So, don't freak out if you test positive because most people I see with chronic illness have at least 8 or 10 of these 16 MSIDS factors associated.
It's so interesting to me that oftentimes doctors are so very happy to chase lab work. And people, I would even say, I see this in the DNA 360, people are very happy to chase things on paper without actually validating within yourself, is it truly a problem? Or working with a provider to understand, is it a problem? Because we're exposed to so many of these things, but based on genes, based on health histories, based on all the fun things that make you you, that doesn't mean it's going to land equally within your body. Yeah.
Yeah.
That's a very good thought to be offering to the audience. Don't go chasing
Uh,
paper.
Someone asked about hypercoagulation with associated with Lyme. Now, it's interesting. You do see TATs, thrombin antithrombin complexes. You do see it happen, but I don't like years ago, people were even trying heparin and trying other things with it. I don't find it to be necessarily a major problem. I think it's probably more of a major problem in some of the people that have spike proteins and have long COVID, where you get microclots. I think the ones who've had Lyme, who've had long COVID, whether it's from the jab or whether it's from whatever it's caused, those people that have had microclots, those are the ones who probably see the greatest effects, because those are the ones where it affected their lungs. You know, you do CAT scans of the lungs, you're seeing all the damage. But I think the general Lyme patient who's not had microclots, and by the way, since I treat with NAC, I'll tell you a little trick. And I didn't know this. I was the first doctor in the world to publish in April 2020, at the early part of the COVID pandemic. I published the first study on glutathione and NAC for COVID. It was a
Hmm.
series of case studies. I actually got the first one in the world literature. It's been cited more times than any Lyme study I have ever published. It's over, I think it's been cited over 300 times.
Oh.
We did not have one person in our practice die from COVID. And this was way before Paxlovid was around. This is way before immunizations were around. What I was giving to people was NAC, alpha lipoic acid, glutathione to block NF-kappa B,
Mhm.
curcumin and broccoli seed extract, sulforaphane glutathione, glucosinolate to stimulate NRF2 with resveratrol, high vitamin D to get them in the upper range of normal,
Yeah.
melatonin with low dose naltrexone to block NLRP3 inflammasome. So what I was doing is I was basically addressing these inflammatory pathways, which is how we started our conversation today.
Yeah.
And I found that by doing this, and I didn't know this at the time, the virus needed to lower glutathione to replicate. I didn't know
Mm.
that. Nobody knew
Mm.
it. But
Mm.
because my Babesia patients used to come in and say, Doc, I got this air hunger, shortness of breath with Babesia, and I give them a 2,000 milligram shot of glutathione IV, and within minutes they go, oh, my air hunger's gone. The minute people were complaining of shortness of breath from COVID with COVID pneumonia, I said, it worked in Babesia. Let me try it. And I got it into the Journal of Respiratory Case Reports in April 2020. What I didn't know is NAC blocks von Willebrand factor and stops microclots. That's, by the way, how I'm coming
That's
full
so
swing around to
powerful.
about to hypercoagulation. In my patient population, the reason I don't generally think I have to be careful shaving, because I take 1,200 milligrams of NAC every day to stimulate my glutathione pathways and keep replacing glutathione. And if I cut myself shaving, it bleeds more than it should. And I realized afterwards it's because I'm affecting von Willebrand. But it's probably why in my patient population, everyone in my patient population is on NAC alpha lipoic acid glutathione, because it's blocking one of the primary inflammatory pathways, NF-kappa B, that's responsible. And by the way, NF-kappa B, I found in the book, pretty much every chronic disease I looked at, from autism to Alzheimer, NF-kappa B is involved in almost all of them. So you'll see the way I did this new book, Ending Chronic Illness, is for every disease that I mention, I discuss the 16 inflammatory pathways underlying the 16 MSIDS factors and how you can use nutrition and diet to basically work the inflammation.
Mm.
It's actually fascinating. It's stuff I didn't know that I discovered in the writing of the book, which I think is
Yeah.
probably going to end up helping a lot of people.
Yeah. I like the beauty of that full circle, not only to the knack, but kind of back to where we started again, in the sense of, if it's always going to be common terrain disruptions that seed a terrain to inhabit disease, to manifest disease, it's also going to be going back to very similar protocols that addresses those weak points within the terrain in order to seed a better terrain, seed a better resolution to those things.
Yeah.
Yeah. It's very powerful that, while medicine I still think needs to be very individualized, because we all have different health histories, different genetics, different pathogen exposures, there's an element of, common things will always seed that road to recovery, which is important for people to hear as they're navigating it. It's
Yeah.
possible.
Yeah.
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 Yeah. Yeah.
No, I mean, look, I think there's really a lot of hope here. And someone was asking me where these things can be published. My Facebook
Yeah.
is Dr. Dr. period Richard Horowitz. The minute the Alzheimer's disease case studies is published, and I'll be emailing George, the journal editor, tomorrow to find out we're coming at week 3. George, what's going on?
Yeah.
I mean, I'm so excited about this paper because of the implications of what this means.
Yeah.
And one case study does not mean I have solved 1/4 of the Alzheimer's epidemic in the world,
No.
but it might mean that because the article that I'm about to publish talks about all 16 MSIDS factors, right now in Alzheimer's, they're talking the amyloid hypothesis, the mitochondrial hypothesis, the autoimmune hypothesis. But what nobody said is, where's the amyloid coming from? Amyloid is basically produced when you get viruses in your brain or bacteria. The amyloid is produced in response to it to try and protect you. It's not just coming out of nowhere. So it's interesting that even though they've got all these hypotheses for Alzheimer's, what they're generally doing by neurologists is labeling and giving them drugs. When this article comes out, not only will I be saying, oh, there was an autopsy study that showed that biofilm, p-tau, and beta amyloid is associated with Lyme in the brain and Alzheimer's as well as Parkinson's, by the way, not in vivo. This is, autopsy. This will be the first case study showing we can reverse p-tau. And the beta amyloid, by the way, improved in this patient. It lowered 3 months after they did this protocol. This is huge. Now, Dapsone lowers inflammation. It's what's called an inflammasome inhibitor. So whether you have Lyme in your brain causing inflammation related to Alzheimer's, there was an article published by Dr. Lee from Korea in over 3,000 leprosy patients because they use rifampin Dapsone for leprosy. They found that when they give Dapsone to the leprosy patients, the rates of Alzheimer's were 6 times less, whether they had Lyme or not.
Yeah.
And that was Dapsone at a dose of 100. But you'll notice nobody's talking about giving Dapsone to people with Alzheimer's to block inflammation and lower inflammasome activity. The point being, all of these things are interrelated, right? It's not just Lyme disease. It's Lyme maybe overlapping Alzheimer's. It's Lyme sometimes with BART in autism. It's Lyme and leaky gut and mold in this in ADHD. All of these diseases we're talking about have bacteria and viruses and leaky gut and microbiome issues and environmental toxins and mitochondrial. They're not isolated anymore. We're all exposed to these things, which now gives us a new way to be doing chronic disease and ultimately gives you hope. So, that's really the words to finish with here is you should have hope and make sure you're working with a doctor who is working with this model. And if your doctor needs to speak to you, by the way, briefly, I don't charge for brief phone calls and stuff. It's only longer. And again, please try not to use my consultation model. Probably you've never heard this from people. Please don't call me. It's like,
You're
I'm
the creme de la creme when you're
my,
asking
my
people
wife
to
is
calm
really
down.
insisting we have a life together right after everything I've done at this point. So I'm
And
doing my best. I'm trying to be
and
a
a
good husband here.
reminder in support of your wife there, in support of your marriage, the idea that Dr. Horowitz has made a lot of these resources available on his website. And so encouraging the patients out there to start pointing their doctors towards them or the doctors that are on the call, please do engage with those resources as well. And Dr. Horowitz, if I may be so bold, perhaps the next time we get you on, it will be in celebration of this publication of your case report and maybe a conversation very specific to Alzheimer's. We test for genes that are associated to Alzheimer's, both in the ApoE, but separate to that, we also look at genes that can be leveraged in prevention thereof. And so I like the idea of diversifying that conversation of prevention from just diet and exercise to include being aware of your own body terrain, being aware of some of the 6 things that can contribute to this very diffuse, obtuse term that is inflammation, how we can tangibly understand that, and then how we can work towards resolving inflammation and preventing, perhaps maybe even reversing Alzheimer's. Yeah.
I'm the eternal optimist, and it's
Yeah,
probably taken me where I am today, but I'm
exactly.
to be this excited at this stage in my career, like, oh my God, the 16-point MSIDS model is underlying most chronic illness. Oh my God, I'm
It's
reversing
an
Alzheimer's
important
markers with that.
thing.
It's like, normally doctors get a little burnt after seeing as many sick patients as I've seen for 41 years, but it's like I feel energized
I
by
love
the
it.
possibilities of what this means. And yesterday, I can't say who the person is, but I met someone who's on the inside in the present administration in the US who may give me an opportunity to possibly get helping to get some
Great.
funding.
Right.
So I can actually get funding not just for chronic Lyme, proving that Dapsone works, but all the diseases we talked about
Mm.
today, which are inflammation is underlying.
Yeah,
There may even be grants to look at the model for these things. I mean, that would be my life's dream.
that would be
It's probably every
beautiful.
doctor's life dream. So
Yeah.
I never hang my hat on it, but I did have a really interesting conversation a day or two ago with someone who's on the inside. And the universe sometimes provides me, and
Yeah.
most of the time my life has been this way. It's kind of like I keep my hands out. I go, I want to benefit people. I'm here to help. And the
There we go.
universe usually responds. So stay tuned.
It's a
I think
beautiful
some good
thing.
things are coming.
It's a beautiful thing. Well, as a friend of the DNA company, I hope that we get to participate in that journey with you.
That would be great.
And so, to those that have joined us this evening, I want to keep mindful of time, honor everyone's time. Typically, we do end at the half hour. So, for those that have submitted questions, we are recording them and we will respond to many of them through the Facebook page. So, if you'd like to join that, please do join our Facebook page and you'll see responses to those questions within a day or two. Dr. Horowitz, again, we have offered in several places your website and your Substack. So we'll put those into the chat again. Oh, goodness. You, Dr. Horowitz, I haven't asked you this in the past, and you may participate in this, and you're also welcome to opt out. I love our audience for this. So my big fish medical study. So science once upon a time asked this question of, we know exercise is really good for your mental health, for your mood. What is the best form of exercise? And science came back, and remember, this fish started small, and every time I talk about this fish now, it's out to here. Science came back and said dancing, because dancing not only allows movement of the body, but it requires the mind. So it supports not only mental health, but it also supports cognitive health. So to the end of Alzheimer's, at the end of every webinar, we dance out so that we can improve our mental health and so that we can improve our physical health. And the audience has started emailing me and they say, hey, I dance out with you guys, because usually I just require my co-host to be doing it. So I will not require that you dance out. But if you would like to join in the dancing, audiences, come that part of the day where we dance out. My name is Dr. Krista Kosterman. I work with the DNA company that really dives into genes. Today we've had Dr. Richard Horowitz, who is a medical detective and dives into everything that influences your terrain and everything that influences your biome. So audience, thank you so very much for joining us. We will make sure we continue with these webinars. Join the Facebook group and you will see the responses to all the questions. Dr. Horowitz, you can either turn off your cancer. You can either you're already turning off your cancer, but you can turn off your camera or you can participate. We are going to dance out. Is there anything else you'd like to share with the audience before
No,
we
but
do
if you'd like to
sunset?
dance occasionally while you're doing Lyme treatment, you can look up my Ballad of the Deer Tick on YouTube, where I did this with Daryl Hall from Hall and Oates. I wrote the words and music and I'm singing, and Daryl is backing me up. We did this in a studio. If you've not seen this,
No.
it's Ballad of the Deer Tick, Dr. Richard Horowitz. People usually tell me they laugh pretty hard. When I used to give bicillin shots years ago, by the way, when
Yeah.
those were around, they can't even find them these days. When I was doing that for Lyme, I would be singing this song to the patients while I'd be doing that, having them like, dance around and sing with them.
Yeah.
In any case, it's a fun song for those of you who don't know that I do music on the side sometimes too.
Oh, yeah, Dickel. The next time we have you on, we may track that down so that we can dance out to that. That
Thank you
was an
again, Krista, for
invitation.
the
That's all I
opportunity
heard.
today.
That was an invitation. All right, audience. We'll again put those links in the chat so that you can pre-order the book so that your doctor can become engaged with a lot of the training material. If you are looking for a physician, don't hesitate to reach out to the DNA company as well, because we have a lot of Lyme, et cetera, literate practitioners who also focus in DNA. So all things can be gifted to you. All right. Merci beaucoup, audience. We will see you next time. Thank you guys so very much. Au revoir. Au
Au revoir
revoir.
tout le monde.
Tickle.